All right.
Think we're
I
live.
think we're live.
Yep.
We're on. Welcome to our long-awaited rebirth of our health chat with Robin and Kim. Finally back after 6 months. And so we're back and we want to stay consistent again, get back in our routine. But anyway, thank you for your patience. I know people asked, reached out and wanted to know.
I think we froze.
Did we freeze? Sometimes. Okay.
I think we froze. Sorry.
Okay.
Yep.
But anyway, I got a lot of questions like, when are you guys coming back? And I said, we're back. It's official. So today we want to talk about stroke because it's National Stroke Awareness Month. We think it's really important. And what I've learned, which I was so surprised about, that stroke is the 5th leading cause of death. And I was like, whoa, I had no idea it was that high. And it's actually higher than women than I realized. 60% of women, 1 in 5 women between the ages of 55 and 75 are at risk for stroke. For men in that age range, it's 1 in 6. So actually women have a higher risk of getting stroke. So Robin just took a course, a training, and she's going to talk about what she learned. And I think it's really important. And we'll talk about what causes it, how to prevent it, and what you can do. So Robin.
Okay. Yep. So I just have a couple other statistics. So everybody listening, did you talk to them about the YouTube channel?
Oh, no, I do want to say, like, if you can't watch this whole thing, go to our YouTube channel. It's called Health Chat with Robin and Kim. You can follow us there and catch up with any other broadcasts you might have missed.
Right.
Thanks for reminding.
All right. So every 40 seconds, someone in the United States has a stroke.
I read that too. Yeah.
Every 3 minutes and 14 seconds, someone dies of a stroke.
Wow.
And then the 5th leading. And there are different types of strokes. There's ischemic, and I might not pronounce these correctly, so if you're a health professional, I apologize. Hemorrhagic stroke.
Yep.
So that's a blood vessel bursts and spills the blood into the brain. The ischemic is a blood vessel in the brain becomes blocked or narrowed. And then transient ischemic attack, TIA. So people have heard of that, and that's a mini stroke, right?
Yep.
And then the things that it affects. So these are just different things that I learned in this training. In the training, I'm going to be able to go in and teach fitness classes to stroke patients. And it's vital that after people have strokes, that they move. It's more vital. Well, it's vital before. That's what prevents or helps to prevent stroke too, which we'll talk about. But afterward, to help and to make gains on being able to live your daily life, right? You may not gain anything back, and chances are you probably aren't. Most stroke patients, unfortunately, don't. But they can at least make strides to get some things back to help them. So that's what I'll be doing, is teaching that type of class to help. And it's interesting because they're really close to the way we teach regular classes. There's just a few different precautions we have to take. So anyway, I kind of wanted to talk too about like left brain, right brain. I know we've probably heard of that, like it's affected. And if it does your left brain, it affects the right side, right? So it's your speech, your logic, your swallowing, and your memory. And then if it's right brain, it's the left, right? It's artistic, swallowing, imagination, intuition, insight, music awareness, and memory. So those are interesting things too. The other thing, check my little notes here that I wanted to go over. So I talked about exercising. Why exercise? And these are some of the benefits to it. Improve balance and gait mobility, which is a big struggle after you have a stroke. Decrease falls, that's a big struggle as well. Improved weight management. A lot of times some of the barriers for people after stroke is, of course, they're scared, right? They're scared of falling. They're scared of everything because that's a scary thing that happens. They're tired. They're more tired than usual, and they get very depressed as well. So the mood, they just don't really care and want to go. So, but the other things that help once they get past those barriers is improved cognition, improved attention on concentration, improved mood, energy. See, when you're in that bad mood, just like with regular, even if you never had a stroke, you feel much better. Increased energy, improved cardiovascular health and diabetes control, improved quality of sleep, blood pressure, um, reduced risk of future strokes, and then improved quality of life. And then the guidelines, it's very interesting because it's the same as ours. It's recommended by the American Heart Association 150 minutes a week at a moderate intensity, and that's what they're calling for stroke patients as well. So 3 to 5 times a week starting out and progressing to 5 to 7 days a week. And you want to be at 40 to 60% of your heart rate. You want your heart rate, and your RPE is 6 to 7 or 80% of your heart rate max, and then 20 to 40 minutes, as much as you're able to do it. And then it's like large muscle groups and things that you can do, like walking, cycling, stepping, things like that.
Walking is such good therapy anyway, especially if you can do
It
it
is.
outside.
Right, right. Well, yeah, right, right. Um, what else did I want to go over with it? The risk factors, do you want to go over the risk factors like prior, like how not to have a stroke, or you want me to hit those? I can hit them too.
Yeah, why don't you hit them?
Yeah. So you want to manage, and listen, guys, Kim and I preach about this. You probably missed our preaching, but for your regular life. So you want your risk factors: high blood pressure, high cholesterol, diabetes, um, not having a healthy lifestyle. So the drinking, the smoking. Smoking is huge. You need to get rid of your stress.
Mm,
Stress is a proponent of that as well. Where else do I have? Stay active. Maintain that healthy weight. So don't let yourself go off the rails. Get
yeah,
regular checkups, and then treat underlying conditions. So if you have heart disease or AFib, that those things can increase your risk of stroke, and you need to work with a doctor to
yeah.
to
And
help you with that.
it's not like you have, I don't think you have like slow symptoms coming. It just comes on, right? When
Just
you get
comes
a
on.
stroke.
And so Kim's going to tell you how to know the signs, and we're going to
Yeah,
give you an acronym, and we
yep,
will put the acronym in the comments
yeah.
as well, so that you'll know.
Yeah, the acronym is called BEFAST, BEFAST. So B, balance, is a person struggling with balancing, walking or coordination. Eyes is a person having trouble seeing, change in vision in one or both eyes. So F is face, are they drooping on one side? That's a big one. Arms, ask the person to raise both arms. If they can't raise one arm very high, then you know. Speech, can they repeat a simple phrase? And typically their brain is not connecting with their mouth, so they can't really say what you're saying, you're asking them to say. T is time to call 911. So that is crucial to get them help as soon as possible. So those are the things, but I think the face thing a lot of people know about, and can't speech is a big one as well. So I think everybody knows those.
Yeah, and you want to try to, I mean, you really want to try to be fast is for real.
Yeah,
You want to get them somewhere within the first 3 to 4 hours, because if it goes after that point, it causes a lot of damage, because the blood supply to the
right.
brain.
Yep.
So,
Yeah. So it's really
anyway, just yeah, be aware. Be aware this month. Think about it, and those things, and also make strides to stay healthy and active. I mean, we can't stress it enough with everything we always talk about.
I know, and everything we've been through. It's like,
Exactly, exactly.
yeah. So I think that's it. We'll post the Be Fast in the comments. And if you want to watch this again, you can watch it here or go to our YouTube channel. And as always, we want you to have fun and live young, and we'll see you next week.
All right.
All right.
Bye-bye.
Take care. Bye-bye.